Do you sometimes feel small lumps on your neck when you have a sore throat? Or maybe under your arm after a small cut? These lumps could be your body's way of fighting infection, and that's what reactive lymphadenopathy is all about. It's not a disease itself, but a reaction. Think of your lymph nodes like security checkpoints in your body. When germs sneak in, say, from a cold or a skin infection, these checkpoints swell up to trap and destroy the invaders. So if you've ever had a cold and noticed tender bumps near your jaw, you've likely had reactive lymphadenopathy. It's common, usually harmless, and a sign your immune system is doing its job. What causes these swollen lymph nodes? Well, imagine you get a small cut on your finger while cooking. Bacteria from the kitchen might enter through that cut. Your body sounds the alarm, and the lymph nodes in your armpit start working hard to filter out those germs. That's reactive lymphadenopathy in action. Common causes include infections like colds, flu, ear infections, strep throat, or even a dental abscess. Sometimes, it can also happen after vaccinations, like when your arm feels sore and the node under your arm swells a bit. In rare cases, things like autoimmune diseases, where your body mistakenly attacks itself, can also trigger it. But the key point is, your lymph nodes aren't the problem, they're the helpers. How do you know if you have reactive lymphadenopathy? Let's play detective. Have you ever touched your neck and felt a small, movable pea-like lump, especially when you're sick? That's a classic sign. These swollen nodes are usually tender, soft, and less than 2 centimeters, about the size of a pencil eraser. They're most common in the neck, underarms, or groin. You might also have symptoms of the original infection, like a sore throat, fever, or runny nose. For example, if you're fighting a bad cold, the nodes in your neck may swell to help. But here's a red flag: if a lump is hard, very big, doesn't move, or stays for more than 2 to 3 weeks, it's time to see a doctor. That's not typical reactive swelling. Most of the time, you don't need a fancy test to diagnose reactive lymphadenopathy. Your doctor will ask, "Have you been sick recently?" Then they'll gently feel the lumps, checking size, tenderness, and texture. For example, if you had a tooth infection last week and now have a tender node below your jaw, the diagnosis is likely reactive. Usually, no treatment is needed, just rest, fluids, and treating the original infection, like taking medicine for strep throat. Antibiotics only help if bacteria are causing the problem. You can also use a warm cloth on the area to ease discomfort. The swelling usually goes down in a week or 2 as you get better. But if the node grows quickly, or you lose weight without trying, further tests like blood work or a biopsy might be needed to rule out other issues. Can you prevent reactive lymphadenopathy? Well, not really, and you shouldn't want to. Swollen nodes mean your body is protecting you. But you can reduce the infections that cause them. Think of it like locking your front door to keep burglars out. Wash your hands often, especially before eating or after being in public. Brush your teeth daily to avoid dental infections. Keep cuts clean with soap and water, maybe even use a bandage. Stay up to date on vaccines. They prepare your body without making you sick. And if you're around someone with strep or the flu, avoid sharing drinks or utensils. These simple steps help your body stay strong and lower the chances of infections that lead to swollen nodes. Scientists are always learning more about how our immune system works. Recently, researchers are using advanced imaging and AI to study lymph node patterns in swelling. For example, some hospitals now use smart ultrasound tools that help doctors tell the difference between reactive swelling and something more serious, just like how a smart camera recognizes faces. There's also new research on immune fingerprints, blood tests that might one day quickly show if swollen nodes are from a regular infection or something else. While these tools aren't everywhere yet, they promise faster, less invasive answers. The goal is to make sure your body's little security guards get the right attention, without unnecessary worry or tests.